welcome to a special lecture on COVID-19 awareness. Uh, the lecture series is specially designed on protecting yourself from COVID-19 and the workplace. It's lecture number 2 of the series. I'm Dr. Pervez Ahmed. In this particular lectures, we will have a discussions on what is SARS-CoV-2, what is a person under investigations, how long does SARS-CoV-2 survive outside of the body. So let's come towards today's lecture. So what is SARS-CoV-2? SARS-CoV-2 is the virus that causes coronavirus disease 2019, which has been abbreviated as COVID-19. SARS basically stands for severe acute respiratory distress syndrome. It spread easily person to persons. Little any immunes and the humans. For more details, you can click on the links given below. So transmission of the disease, people may have question in their mind that how this disease has been transmitted from one person to person. So be remember, COVID-19 is spread from person to person mainly through coughing, sneezing, talking, and breathing. Droplet respiratory secretions from coughing or sneezing landing on the mucosal surfaces like nose, mouth, and eyes. Aerosol, solid particles or liquid droplets suspended in the air. Contact, touching something with the SARS-2 virus on it and then touching mouth, nose, or eyes. Other possible routes may include through the facial matters. Uh, Incubation periods. The incubation period is the time between the exposure to a virus and the onset of symptoms. With COVID-19, symptoms measured 2 to 14 days after the exposures. CDC indicate that people are most contagious when they are the most symptomatic. Several studies shows people may be contagious before developing symptoms. COVID-19 can cause mild to severe symptoms. Most common symptoms include fever, cough, shortness of breath. Other symptoms may include sore throats, runny or stuffy nose, body itches, headache, chills, fatigue, gastrointestinal, loss of smell and taste. Severe symptoms, that is emergency warning signs for COVID-19. Most people will have mild symptoms and should recover at home and not go to the hospital or emergency rooms. Get medical attention immediately if you have difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. So what is a person under investigations? So a person who has both consistent signs or symptoms of risk factors as follows. Suspect case, potential exposures within 14 days before the onset of the symptoms. Symptoms including cough, fever, and shortness of breath. So conform case, what is mean by conform case? A conform case is a suspect case with a laboratory conformed diagnostic evidence of SARS-CoV-2 virus infections. So how long does SARS-CoV-2 survive outside of the body? So it is not clear yet how long the coronavirus can live on the surface, but it seems to behave like other coronaviruses. So viruses may persist on the surface for a few hours or up to several days, depending on the conditions and the type of the surfaces. It is likely that it can be killed with a sample disinfectant on the EPA register list below. For further detail, you can click the link given below. The increased risk of severe illness. COVID-19 poses a greater risk for severe illnesses for people with underlying health conditions, which include heart disease, lung disease such as asthma, diabetes, suppressed immune systems. The elderly have higher rates of severe illness from COVID-19. Children and younger adults have had less severe illness and death because COVID-19 is new. There are a lot of scientific unknowns such as impact on the pregnant woman and their fetuses. So what is the people normally ask the questions that what is the difference between the seasonal flu and COVID-19? So in the coming lines, we will show a difference. That is, we will draw lines between the seasonal flu versus COVID-19. So COVID-19 has the potential to cause more death and hospitalizations. SARS-CoV-2 is much more infectious and spread faster than the seasonal flu. So far, the case fatality rate, CFR, or COVID-19 is estimated to be around 2%. The CFR of seasonal influenza is estimated to be around 0.1%, making SARS-CoV-2 about 20 times more deadly than the seasonal flu. An estimated 5 to 20% of the infected individuals may suffer from severe symptoms that require medical attention, including pneumonia with shortness of breath and lower blood oxygen saturations. No treatments. Immunity unknown how long. Uh, immunity unknown how long it will last. False illness or vaccinations. So pandemic influenza, if you want to do the comparison of the COVID-19 with the pandemic influenza, so experts have been recommending preparedness, warning about the likelihood of future pandemic influenza outbreak for decades. Flu pandemic fatalities worldwide in the last century, that is in 1918 between 40 and 100 millions, 1957 up to 2 millions, and 1968 is around 1 million. So that is means the fatalities we have worldwide in the last century due to flu pandemic. So treatment and vaccines. In December 2020, the FDA gave emergency use authorizations to two COVID-19 vaccines, with many more in the pipeline. There is no specific FDA cleared medications or treatment for COVID-19, so treatment is supportive. People who are mildly ill with the COVID-19 should isolate at home during their illnesses. So, this is a brief introduction of COVID-19 and its effect on the human bodies and how it spreads. So there are more details to come about the protection of yourself from COVID-19 and the workplace. That is, in the coming lectures, we will have what we will discuss on the key. We will have a discussion on the key exposure factor in the workplace, and then we will have a discussion on the high, medium, and low potentials for the exposure. So that's all for this lecture. See you in next lecture with more details about protecting yourself from COVID-19 at the workplace. Till then, bye bye.